and welcome in. We're finishing up our series. Actually, we're talking about strokes, and May is Stroke Month, and we have been so blessed to have the star of the show here with us, Dr. Balasetti. It's been a joy to have you, and this time I told you we had a surprise. Well, you know, things are changing and they're getting better all the time. And Dr. Balasetti does a procedure that is absolutely amazing, and it's new. And you're the only doctor here who does this. You do it at Baptist South because that's really the heart center for our area. Mm-hmm. And it's a thrombectomy. Would you please tell us what great news there is on this new front that we can do something that's different and better?
Absolutely. So, like you just mentioned, treatments have. With the advances in the medical field itself, treatment for stroke has progressed a lot in the last few years. It starts with the clot-busting medication, which was the only treatment that we had that has been proven or is part of the guidelines, if you can say, for stroke treatment for a long time. And that was since 1995 when the NIH-funded trial came out that said that TPA, or the clot-busting medication, helps improve the outcomes in patients with stroke.
Okay.
And for a long time, we were doing this. That was the only treatment for stroke patients. But more recently, which was in 2014, is when several of the newer trials came out that looked at techniques where we could go in and retrieve the clot.
Oh, so you can just actually go in and remove that specific clot.
That's correct.
Wow.
Yeah. So one of the problems with the clot busting medication is that it's effective, but it does not help recanalize the blocked blood vessel completely, or it's only effective in 30% of the cases. Especially with these major strokes where you are expecting significant disability, and those are because of significant clot burden. And so the clot busting medication is not very helpful in recanalizing those blood vessels or breaking those clots open.
So is that where you would have larger, more prevalent clots instead of like smaller ones, or does it matter?
Yeah, so we are talking about strokes where the major blood vessels are being blocked. So when the carotid artery goes up into the brain, it divides into two major blood vessels. So if one of those two blood vessels gets blocked, then you are talking about a large real estate at risk.
Okay.
So it's of importance there that you take the clot out soon and completely so as to give a patient the maximum chance towards recovery. And so this particular treatment, like I said, with the studies that came out in 2014, showed that are very effective in doing that safely and effectively, and they improve the patient outcomes significantly compared
Wonderful.
to just the clot busting medication itself.
So what is that procedure? How do you do it?
So it's similar to the heart cath. I know that's more prevalent, so people understand that better. That's why I use that often to make them understand better. These are minimally invasive techniques where we are going through a small hole in the blood vessel, either in the arm or in the leg or in the groin.
Okay.
From within the blood vessel, we use a small needle to access the blood vessel, and through that we take our special device, our catheters, which are 3 millimeters in width or diameter, and we take it all the way up to the clot. And we use certain techniques. There are two different techniques.
So how would I get to you? Let's say I have a stroke, or how would I get you to be the one who does this procedure, since you're the only one who does it? How does a patient get to you?
So I'm hoping that programs like these help get that message out to the people, to the community, that Baptist South is that center here that can provide that kind of care. And like as mentioned in the previous sessions, where we have to call 911, the EMS is involved. EMS is trained in identifying these patients with those large vessel occlusions based on certain clinical features, like how their weaknesses or how bad their weaknesses, how their eyes are, how their speech is, and all of that. That helps them, or at least gives them a clue on what to expect, and then triage them appropriate to an appropriate center that can do this kind of procedure. So that way, we are cutting down on time in preventing them to go from going to another hospital which is not equipped
Right.
with, because those patients will eventually be transferred to this
Right.
center again
Right.
that would be able to do this. So it's important to do all of that. So spread awareness among the community to understand that this is a center where, or not just Baptist, any center that can do that. That's the important point here. You have to get to the place where you can get the right treatment at the right time.
Wow, because like you said, that's your enemy
That's correct.
or your friend,
That's correct.
one way or another.
Mm-hmm.
Well, then if the people, the EMAs, if they see this and realize this is bad, this is
Mhm.
not just a little stroke,
Mm-hmm.
the likelihood that there's a large clot, then they know ahead of time somebody gets hold of you. Is that how that works?
Yes, usually they communicate with the ER, and we are on the loop already.
Okay.
And they get to the ER, they get some scans done
Okay.
to see if they would be eligible for this kind of treatment. And we are involved right from the beginning of that process. We are involved right from the beginning. They come to the ER, get the scans done, so we get all that information right away.
That is just a godsend. That really is what it is. If it can not just save a life, but give you a productive life.
Mhm.
Thank you so very much. We have loved having you, and we
You're
will
welcome.
have you back again.
Very
All
welcome.
right.
Thank
God
you so much
bless
for
you
having
and your
me on.
procedure.
Thank you.
And thank you for being with us, and we'll be right back.